Yes, hello. My name is Choi Jinbong, Professor of Urology at Catholic University Bucheon St. Mary's Hospital. And today, I'll be explaining what donor nephrectomy is. In urology, the procedure donor nephrectomy is seen in two ways, such as the removal of the kidney, called open nephrectomy, or the minimally invasive surgery, called laparoscopic nephrectomy. The type of donor nephrectomy that we'll be talking about today will be open nephrectomy, the removal of a kidney in order to transplant into a recipient. In the past, donor nephrectomy was all performed as an open nephrectomy, but the first laparoscopic nephrectomy was performed at our St. Mary's Hospital in Gangnam. Back in those days, the incisions were about 20 to 30 centimeters long, so it resulted in more pain and longer recovery periods for patients. But in recent days, there has been advancement in laparoscopic machines and techniques, so only an 8 centimeter long incision is made in order to remove the kidney. Therefore, recovery time as well as being discharged from the hospital has gone faster. Yes, that is correct. As soon as the donor is designated, all of the basic tests are proceeded in the nephrology department. So we don't proceed with extra tests, but with all the test results. The nephrology, urology, and transplant surgery departments would look at it and make the final decision together. And we proceed, and I guess we call it the transplant meeting. The test results that we usually check in the final meeting are the scan results that we get from the CT scans to check the shape and status of the kidney as well as the blood vessels. There's also another scan test to check the function of the kidney, as usually a donor nephrectomy is performed on the left kidney. That's because the renal vein of the left kidney is much longer and therefore is more preferred. But after seeing the kidney segmentation, if the right is much weaker than the left, as it is a rule to donate the weaker kidney, the right one should be donated. So these are what the three departments would check and decide on the results. I'm sure that's the part most people worry about. However, according to NECA's research results, when we compare about 2,000 kidney donors with normal 2,000 people, metabolic diseases such as diabetes, high blood pressure, and obesity occur at a similar rate, and there was no actual difference in the death rates. But the kidney functions do become weaker, so it'll be hard for the first 6 months for the donors. It might take a toll on their body temporarily. The reason is, one kidney is functioning like two kidneys, when the body weight and size are still the same. Can be a burden, so from the first month to 6 months, we tell the patients to be careful as it might be too much for the body. Especially at the beginning, we need to look closely at the kidney function and take care of it, so that it doesn't become chronic kidney failure. So I recommend you take care of it in the early stage. Yes, there are. There are some conditions that KONOS, or Korean Network for Organ Sharing, made. To give a rough idea, it needs to be a healthy person between 16 to 65 years old, and they have to donate voluntarily, of course, with a doctor. And it's known to be accepted only when they have a close relationship, such as relatives or a spouse. Also, when they have serious medical diseases or malignant tumor infections, they cannot be donors. At the beginning of this conversation, I said that donor nephrectomy has two ways of operating and one being open nephrectomy. Open nephrectomy is not only performed to the donors, but also for patients with renal cell cancer, kidney function degradation, and some other kidney problems. But the difference between the patient and the donor is that we extract the kidney, examine it, and then discard them. But during donor nephrectomy, as we need to take the kidney out in perfect condition and give it to the recipient. We're very careful when it comes with handling the kidney and try not to cause any harm to the kidney during the operation since it shouldn't be damaged. So in that sense, donor nephrectomy is a bit harder, especially when the person had a kidney issue before or when they have adhesion by the damage. It becomes more difficult. As I mentioned before, an 8-centimeter incision is needed for laparoscopic nephrectomy. No matter how advanced it's gone, we still need to make 3 holes in the skin, so yes, it may cause pain. But it did improve much better than the old open nephrectomy. Previously, we would use a high amount of painkillers when doing open nephrectomy. But now with the laparoscopic nephrectomy, the dose of painkillers remarkably reduced. And because of that, we can keep the kidney function a whole lot better. When too many painkillers are used, it may decrease the function of the kidney that's left. So, it's really good in that sense. Overall, the pain has reduced a lot than the open nephrectomy. Usually, when only the laparoscopic nephrectomy was performed, in the case of our hospital, we planned the discharge of a patient on the 5th day after the surgery. Depending on individuals, if one's recovery of bowel movement is a little bit slow, or recovery of cardiopulmonary functions is slow in elderly patients, they might stay hospitalized for an entire week. But usually we prepare a patient's discharge in 5 days, and normally a week after being discharged, patients visit a urologist to check if there's any acute complications, and afterwards, early kidney function care is extremely important, as I explained before. So a nephrologist will carry out periodic inspections every month or 6 months. And meanwhile, I want my patients to make sure of that. As I said in the beginning, it's very burdening to the body, since there was a transition from 2 kidneys to 1 kidney. So it's recommended to manage weight through a diet. And in order to avoid straining the kidneys, it is best to have sufficient water intake and go on a low-sodium diet. Other than that, there are those who look for highly nourishing food after surgery that they don't usually eat. That is not a good habit, so eat like you normally did and drink enough water, and go on a low-sodium diet and avoid weight gains. So today, I briefly explained about donor nephrectomy. Other than this, if we arrange a surgery, we are giving these explanations in more detail through the consent. So if you have any more questions, come visit us. This was Choi Jinbong, Professor of Urology at Catholic University Bucheon St. Mary's Hospital. Thank you.